You are seeing a 3-week-old male infant in the pediatric clinic. The parents are concerned that their baby seems unusually stiff and startles very easily, especially in response to sudden noises or touch. They also mention that during episodes of startling, the baby becomes very rigid and occasionally has difficulty breathing for a few seconds. The infant was born at full term, with no complications during pregnancy or delivery. There is a family history of similar issues, as the baby's maternal uncle had a condition where he would freeze when startled.
What is your differential diagnosis for this infant presenting with stiffness and an exaggerated startle response?
Hyperekplexia, epilepsy, stiff person syndrome, neonatal seizures, neuropsychiatric startle disorder, hypertonic cerebral palsy.
What additional historical information would you ask the parents?
Hypertonia that may worsen after a startle response. Exaggerated startle reflex to unexpected stimuli. Noise, touch, or movement. Possibly jerking movements or spastic myoclonic jerks. Normal neurological development except for hyperreflexia and hypertonia. Lack of seizures or loss of consciousness during episodes.
What are the key diagnostic steps to confirm hyperekplexia?
Genetic testing for mutations, as these are most commonly associated with hyperekplexia. EMG, to assess the electrical activity of the muscles. EEG, to rule out epilepsy. Clinical observation, noting the exaggerated startle response and muscle stiffness at birth.
What other conditions should be ruled out during diagnostic testing?
Startle epilepsy, via EEG to rule out epileptic seizures. Stiff person syndrome, characterized by progressive stiffness and spasms but typically later onset.
What is the first-line treatment for hyperekplexia?
Clonazepam, an anti-anxiety and antispastic drug, used to reduce exaggerated startle responses and muscle stiffness.
What are other therapeutic options for managing hyperekplexia if clonazepam is not sufficient?